Well, Cynthia, public anxiety surrounding the coronavirus and the vulnerability of children has resulted in calls for drastic measures to be taken to protect them. Now, many daycares are already asking for self-quarantine if a child or a family member has traveled to China recently. There's even an online petition apparently from parents demanding one school board take some rather extreme protocols in order to ensure the safety of students and staff. Now, we spoke to one expert who cautions against overreaction to the virus.
We are requesting for the 2-week self-quarantine period for any families, staff, students who have traveled recently, whether it have been to China or Hong Kong, or whether they've been exposed to the airports that have the transferring flights there for China and Hong Kong.
It's one of several precautions being taken at Tender Treasures Daycare in Woodbridge. Ventura says the Montessori school has also been educating parents and kids and being even more diligent with hand washing and sanitation of toys. She says the daycare consulted with others in the area who are all engaging in similar practices. Does it feel like it's maybe too much or more than what is needed?
No.
Carrie Bowman is a bioethicist at the University of Toronto who worked on the front lines during the SARS outbreak. He cautions against asking for self-quarantines. What do you make of that?
No, I think that's going too far. I think if a person was in the absolute epicenter of Wuhan, that is a personal decision people may make. Mm-hmm. But China's a massive nation with many, many people, and I think that's far too extreme.
But even more extreme is an online petition apparently from parents of students at schools in York Region. It demands that school boards take several safety measures, including asking students and their families who travel to China to report to the school so that the school can keep a tracking status. It also demands that students be allowed to wear masks. So far, it has more than 8,000 signatures.
Having looked at the petition, it is not grounded in, science at this point at all. I fear it breeds a climate of fear, and I also worry that it can have some suggestive, negative, and even prejudicial components to it.
Bowman, along with other health professionals, are reminding the public to put the novel coronavirus threat in perspective.
As much as we're very concerned about coronavirus, the number of people that are dying from flu is actually far greater in any given season than anything we're seeing from coronavirus. So one of the important things for flu is that you do get treatment quickly.
I don't blame any parent for being concerned. The safety of children always comes first, but this is not a reasonable way to express those concerns.
Now, Bowman says reasonable precautions include watching for symptoms in kids and adults, and also being diligent with hand washing and sanitation practices, as many daycares already are.